According to a study in the Journal of the American College of Cardiology, beta blockers improve all-cause mortality in patients with chronic kidney disease and heart failure. The authors reviewed the effects of beta blockers on clinical endpoints in 8 trials involving nearly 7,000 patients with CKD, stages 3 to 5, including those on dialysis. 6 trials enrolled patients with heart failure. In those, beta blockers reduced the all-cause mortality risk by 28%. And post-hoc analyses showed that the treatment effect was similar in CKD patients and in those without CKD. Beta blockers also significantly reduced the risk of cardiovascular mortality and sudden death in 4 trials that reported these outcomes. They did not affect the risk of all-cause hospitalization. However, in the heart failure studies, beta blocker therapy was also associated with an increased risk of bradycardia and hypotension when compared with placebo. Data were inadequate to make conclusions about the effects of beta blockers on mortality in non-heart failure studies. The authors concluded that their findings strongly support the use of beta blockers in patients who have mild to moderate CKD and heart failure. Citing a lack of evidence for those without heart failure, the authors said, "We suggest cautious use of beta blockers and the decision be based on case-to-case basis." This is Dr. Michael Banks for Reuters Health, the Doctor's Channel Daily Newscast.